Hey guys, my name is Ashley, and today I'm going to be talking about vascular compressions. So what are they, how have they impacted my life, and what are some different types? Before we get started, I would really appreciate it if y'all liked and subscribed. It would mean a lot to me. And please, if you have any questions at all, comment down below. I would be happy to answer them. So yeah, let's get started. First off, what are vascular compressions? Vascular compressions are rare conditions when your blood vessels, such as an artery or a vein, are either getting compressed or are compressing something else. The ones I'm going to be talking about today are median arcuate ligament syndrome, nutcracker syndrome, and superior mesenteric artery syndrome. I was also just diagnosed with May-Thorner syndrome. I'm going to save that for another time. Let's start off with SMAS. SMAS, superior mesenteric artery syndrome, has a rareness of 0.01% and unfortunately has a mortality rate of 33%. It is when the superior mesenteric artery and the aorta clamp down or compress the first section of your intestines called the duodenum. Because of this blockage, food is unable to pass through, so you end up throwing it all up. There are many symptoms, but the main ones are severe abdominal pain, nausea, vomiting after eating, weight loss, POTS symptoms, and a lot more. The cures for this are a feeding tube, where you would be able to gain some weight and hopefully not throw up as much, along with two different kinds of surgeries, the Strauss procedure and the duodenojejunectomy. I have had both of these surgeries done, along with a small bowel resection, but unfortunately I'm still experiencing symptoms. The next compression I'm going to be talking about is nutcracker syndrome, which is the compression of the left renal vein. The left renal vein carries blood away from your left kidney back to your heart. It is actually a bit similar to SMAS because it is the same two arteries, the aorta and the superior mesenteric artery, that are compressing your left renal vein. There is a very long list of symptoms for nutcracker, such as flank pain, blood in the urine, pelvic pain, abdominal pain, fatigue, POTS symptoms, headaches, leg swelling. The list goes on, but what it's most known for is the pain. This is actually where the name nutcracker syndrome comes from because it mimics being crushed by a nutcracker. Flare-ups for this can come at any time, and so it's a bit unpredictable and challenging to live with. Whenever I get a flare-up, I'm almost unable to move. I have to go lay in bed with a really strong heating pad and just wait it out. The main surgical options for this are placing a stent, getting a left renal vein transposition, and a kidney auto transplant. In a typical kidney transplant, they actually keep both of your damaged kidneys and add in a third one. With an auto transplant, they take out the one that's being damaged and then they move it to a different area. So for my case, they would be moving it to the right side. I just found out I was a candidate for this surgery, so I'm hoping to be getting it sometime soon. Despite having proof on my scans for a long time, I didn't get an actual diagnosis until I got a venogram done in March in Boston. When something gets compressed, the pressure within it is going to be much greater. So in March, it was 2 to 3 times what it should be in my left renal vein. I just got another venogram done in Wisconsin last week, and unfortunately, I have severe stenosis, meaning it is 8 times what it should be now. Researchers are still trying to figure out how rare it is because it is so uncommon, so there's not a specific statistic for that. Median arcuate ligament syndrome, or MALS, is found in about 2 out of every 100,000 patients, meaning its rareness is 0.002%. It occurs when the median arcuate ligament, which is an arch-shaped band of tissue on the chest that connects the diaphragm to the spine, compresses the celiac artery or the celiac plexus nerves. The celiac artery supplies blood to the stomach, liver, spleen, abdominal esophagus, and parts of the pancreas and duodenum, which is the section of intestine being compressed in superior mesenteric artery syndrome. The celiac plexus nerves are a bundle of nerves located in the upper abdomen near the aorta, so right in this epigastric region. They connect many organs to the spine and brain, such as the intestines, liver, pancreas, and gallbladder. The compression of either one of these structures in the body can cause serious symptoms. The most well-known MALS symptom is severe abdominal pain after eating, but there are many others such as nausea, vomiting, muscle and exercise intolerance, pressure and tightness in the upper abdomen and chest, weight loss, exhaustion, delayed emptying or paralysis of the stomach, and many other symptoms. The interesting thing about my case is I actually don't have a celiac artery, but we are discovering that it is still possible to have MALS without one. A big part of the MALS diagnostic process is getting something called a celiac plexus block done. This is when they give you injections and block the celiac plexus nerves, and it lasts for around 6 to 24 hours. Now, if during this time period you don't experience the serious symptoms and the pain when eating, you know that surgery would help you, and then you can hopefully get an official diagnosis. When I got mine done a couple months ago, back in June, they did it incorrectly because of my different anatomy. So things got a lot worse. But I'm going to be redoing it in September, and hopefully I can get an official diagnosis and then hopefully surgery. The thing about vascular compressions is that very few doctors believe that they are real. There's this sort of constant advocacy going on in our everyday lives. I try to tell people what they are or that I have them, and oftentimes I find myself explaining to doctors what's going on, when that should not be my job. That's their job. I am really grateful to the ones who listen though, but it can be pretty frustrating. You have to do your own research and travel all the time to look for help. I've had so many tests, procedures, several surgeries done, and never knowing when your symptoms are going to flare up makes it pretty challenging to live with. I have met an amazing group of people online though who are also going through the same thing, so that's been very helpful. And that's why I'm trying to post videos like these so I can spread more awareness. Anyways, that wraps up this video. Thank you all so much for watching. I really appreciate it. And hopefully this can help somebody who's going through a similar experience.